welcome to Midtown Community Health Center Diabetes Educational Videos. My name is Sari Ming Rivera and I'm a registered dietitian and diabetes educator with the clinic. Today we're going to be talking on how to use your insulin pen. But before we get there, I want to share with you a few techniques very important for you. Imagine that this piece of paper, it's going to go on your belly where you put your belly button right in the middle. The circles are the sites where it's ideal to inject insulin, but the importance is that we rotate, that we pick different sites through the day and week so we don't overwhelm the area. There are other sites in our body where you can inject your insulin, like the outside of your thighs. On the back, you can do the glutes or the back of your arms, and these are great places where someone else can help you with the injection, and then if it's easier for you to do the front part of your body. Why is it important to do the rotation? It's because doing this rotation we can avoid fat disposal in your skin. So if you can see here, there's a big bump, and that's fat that accumulate over time by selecting the same side to poke your insulin. They can be very small fat disposition, medium size or bigger size. So touching the skin and selecting a smooth area is the smart way to do it, to avoid this to happen. If you inject insulin right there, the insulin absorption is going to be way less to none, and then your sugars are going to stay high and your insulin is going to be wasted. So it's very smart to do side rotation so you get a better absorption of the insulin. Let's move to how to use the pen. You need the needle. The needle is going to come with the insulin, and you need alcohol to clean the area where the needle is going to go, and your skin. I'm going to pretend that this orange is going to be your abdomen area. A lot of people still using syringes, and that's totally fine. But today we're going to focus on how to use the pen. Also, your pharmacist may give you a booklet with written instructions on how to use the insulin. What we do first is that we open the alcohol swab, and we are going to open the pen. This area here is where we insert the needle. So we gotta clean it to make sure it's clean all the way, and then you open the needle that it's going to be individually wrapped. That will go in, and you move it, you twist it so you can pull it out. This is a second safety cap, and you leave it there for a moment. Use the same alcohol swab to clean the area where you're going to be injecting, and let it dry by itself to avoid contamination if you blow it or use another napkin or tissue. Let it dry by itself. Now we're gonna do a couple of things here. If you use an insulin that it's cloudy, that it has clear liquid but also has like a white solution, one technique to miss that is to do this twist between your hands, or to move it this way. This rotation will mix it just perfect. Most insulins are gonna be just clear, and you don't have to do that. The second thing we're gonna do here is that we're gonna have 1 or 2 units of insulin to test the needle. And that right there with the red line, you're showing 2 units. Then you remove the cap and you press the button, and you can see that there's a drop there. It means the needle it's working. You let that go, and you adjust depending on how many units of insulin you're gonna use. Let's say your doctor prescribed 5 units of insulin. Choose the line between the 4 and the 6 that it's going with the red line. Now we inject on a degree, no degree. We don't want any degree. We want to go straight into the skin. So this is your area where we clean. Once we go in, we're gonna push this button until it goes down to 0, and then we count 10 seconds inside your skin to make sure the delivery of the insulin go into your skin. All right, so let's do that. You go in and then you press. When it goes all the way down to 0, you count 2000, 2001, all the way to 2010. You bring it out and cover it with that safety cap. You can do the second one, remove it. We want to avoid leaving it there to reduce, just to prevent that it doesn't get contaminated with used needles. And this is ready to be closed. Your needles, you can use a container that is sharp proof, so like a used gallon of milk, empty gallon of milk that you can keep adding them for safety, and or you can buy one at a pharmacy or a store. Once you start using the pen, it's good if you write down the day when you started using it, so that way you have 28 days to use the pen with the insulin that is in there. If 28 days go by and you still have insulin, it's time to toss it. The insulin that are new, the new pens, they can stay in the refrigerator, should be refrigerated, but the one that you used can be out of the refrigerator for about 28 days. And ask your pharmacist, they'll tell you what's the correct dates for the insulin you're using. If you have any specific question, always contact your doctor, your pharmacist, or you can make an appointment with myself at 801-334-1335. Thank you.